A little bit of housekeeping before we go. Thank you for joining. We're going to be doing, and I'll introduce soon our two speakers for today. You will notice the chat function at the bottom of your screen. So if you wave your mouse, there's a little chat function. If you've got any questions or comments that you would like to pose to the speakers or myself today, we'll be gathering those questions and being able to talk about them after Paul and Cass have spoken. So I just encourage you to use that chat function. There's not going to be a way to audibly speak your questions, so please get typing and we'll be able to hopefully get through those questions today. At the end, I'll be able to give you a bit more information about the rest of the week, but we're excited to launch Schizophrenia Awareness Week for today. So we're starting off with the topic of lived experience, because here at One Door, we believe that people with a lived experience are the most important people to be shaping and delivering effective recovery-orientated mental health services. I think that's a no-brainer for myself and for others here at One Door. Today, we're focusing on two programs in One Door that have peer workers as a predominant workforce for the program. And I'm excited to be able to share with you two great staff members of One Door who are going to share their current working experiences in two different programs within One Door. The two programs, and we love our acronyms in mental health services. The first one is our PICS program, which is our Primary Integrated Care Service, which is funded by Central and Eastern Sydney PHN. And the other one is H2H, or Hospital to Home, which is funded by Western Sydney Primary Health Network. Now we're going to start off with Paul, and if I can introduce Paul. Paul is a peer worker, a peer support worker. He's an accredited exercise physiologist and a professional educator. He sees lived experience of mental illness as an asset, and he blends his skills gained from his lived experience and the knowledge from his studies in arts and science to support others in their recovery. I welcome Paul. Paul's going to start off, and then I'll introduce Cassandra, who's our next speaker. And Paul's going to be able to talk about the PICS service and his role there. So I'll hand it over to Paul, and he's going to share his screen and start talking and sharing with us. Thanks, Paul.
Thanks very much, Kathy. I'll just share my screen now. Schizophrenia Awareness Week, stay connected. 18th of May, 27 years ago, I was disconnected from reality, from myself and others. I was barely eating or talking. I was literally walking backwards and in circles. I didn't trust others. I had no job, wasn't able to study or socialize. I couldn't have a relationship. Things may have stayed this way or even gotten worse. And after being hospitalized, I could have stayed disconnected from others and life. But I was determined. I believed that if my mind could produce such great distress in me, it could also produce something else great. And to me, that was simply to have an ordinary life. A job, a partner, a home, a life connected. In 2013, I worked as a personal fitness trainer on the New Moves Healthy Lifestyle program with One Door Mental Health, known then as the Schizophrenia Fellowship of New South Wales. And since then, I've worked as an exercise physiologist and professional educator, and 1 year ago was employed as a peer worker for the PICS program, using my lived experience to support others in their mental health recovery. PICS stands for Primary Integrated Care Supports. In this program, 14 credentialed mental health nurses, which is equivalent to 10 full-time nurses, who provide clinical care and coordination for people with mental illness, work in tandem with 8 peer workers who provide psychosocial rehabilitation or a self-directed strengths-based model of recovery. Each of the peer workers is supported to attend professional development, mental health first aid, suicide assist first aid, Cert 4 in mental health, and Aboriginal and Torres Strait Islander cultural competence training. We have a peer coordinator, a learning circle supervisor, and management to supervise us and to report to. One of the unique aspects of PICS is the synergy of peer workers and mental health nurses and the product of a multimodal approach to healthcare, the modalities of mental health nursing and the modality of the lived experience. PICS practices across the Central and Eastern Sydney Primary Health Network, partnering with over 30 health and community services and organisations across the region. For example, St John of God Hospital in Burwood, Headspace in Camperdown, and Mind Plasticity, to name a few. This map shows where people access PICS practices, the greater concentrations with the larger circles. There were 50,000 occasions of service since August 2017 and 5,000 to 6,000 occasions of service per quarter. This photo is of John on the left, a man supported by one of our peer workers, Jim, on the right. John said that Jim came along and changed his life. He was depressed and suicidal. The ideation has been disappearing and he is healing. Jim has been a voice at medical appointments. Peer workers also run walking, fishing, and cafe groups. Some of the examples of what I do in my role as a peer worker include supporting people in their physical health or activity. Though specifically I do my exercise physiology work through One Door Healthcare, I support one guy whose great joy it is to meet every fortnight to kick and throw a ball around. Psychosocial support may also extend to supporting someone to access a food parcel, for example, through Exodus Foundation, attend a financial counselling appointment at MoneyCare, attend legal aid for a dispute with a landlord or Department of Housing, attend a mediation for a family conflict, go to Centrelink with someone who has had their disability support pension application rejected, supporting someone for their National Disability Insurance application, provide social encouragement to go to the art gallery or cultural event, or just to go to a cafe like anyone else might like to. Staying connected by phone or Zoom during COVID. I use the skills and strategies I have gained in my own recovery to support others in their recovery. For example, learning to speak up and self-advocate, passing on lived experience tips for smoking cessation, putting together a phone list for hard times, a safety plan, or list of things to do when overwhelmed, or what to do when you just can't get off the couch, how to set educational goals, and find ways to increase social opportunities. Some of the feedback from the people I support has included, he provides me constant motivation, provides positivity, ability to clarify information. Linking is a key strength of his. He is a big advocate for mindfulness and being loving towards yourself. He made me feel like he cared. His job is really tough, but he comes to it with joy. He not only listens, but he hears what you're saying. He brings a vast knowledge of numerous topics to our conversations, which has not only been a great benefit to both my mental health and well-being, but also my confidence in conversing with people again. Peer workers support about a quarter of the people the nurses are working with on a range of recovery goals. In 18 months, peer workers set over 700 goals, ranging from physical health to social engagement to education and employment. Goal objectives included increasing coping skills and enhancing relationships, increasing confidence, make life changes. Outcomes. The K10 is a measure of psychological distress. A periodic assessment of the PICS participants measured a 34% deterioration, no change in 30%, 13%, I should say, and a 53% improvement for their psychological distress. Here are some of the highlights from an external evaluation. Peer workers are role models for living life. They connect me to services and groups in the community. In an experience of service survey, 93% of respondents rated satisfaction as excellent and very good. The PICS program helps people living with a mental illness stay connected to themselves, their own thoughts and feelings, connected to peer workers and nurses and other health professionals, connected to social services, advocacy groups, consumer groups, recreation, leisure, education and employment. Contact One Door Healthcare on Sydney 02 9199 6143 to find out more or make a referral.
Thanks, Paul. That was great. I must say that I really like the saying you said of role models for living life. So thanks so much for sharing. And you know what, in all my nerves, and it's good that even as the job that I have, I get very nervous at times and stuff up. I forgot something that we were going to do at the beginning, and I think it's important that we do it. So one of the things we do at One Door is a bit of check-in before we start, kind of to be present and stuff. And so I know with the participants who are out there can't contribute to this, but I thought it would be worthwhile going on to just get a bit of humanness about each other. So it's a question that's not related to anything to do with what we're talking about, but it is something about being present and being and learning a bit more about each other. It's just a question for both of you guys. What was your least favourite food as a child, and do you still hate it or love it now? So let's hear from you, Paul.
Well, something that I had to eat as a child was a boiled cabbage and boiled spinach. I'm not too keen on the cabbage still, but spinach I quite like, but probably not boiled to the extent that they used to do it back then.
Oh yes, indeed. And Cass, for you?
I've got to say button mushrooms. My mum used to put them in spaghetti bolognese and they would just taste like little balls of slime to me, but now I love button mushrooms. Yeah. It doesn't look like you do.
No, I don't mind button mushrooms, but I think it's when you describe them. I think that's the thing.
Yeah, they weren't good. Now I cook them a little bit differently than that, but no, they're really nice now.
That's good. That's good. I must say, for me, there wasn't many things as a kid I didn't eat that I still don't eat now, which made me reflect on what my children now are like, because they don't eat much, but I'm hoping that changes over life. But there was one thing as a younger person, and it's still the same, is coriander, and for me, am not a kid, and so for me, that's it. But thanks for that, and I'll remember for tomorrow to make sure that I follow my script and do that. But we all get nervous and do different things. But it leads me into talking to Cass and allowing her to talk and be able to talk with us about the hospital to home program. And I won't steal her thunder. But Cassandra has a master's, and that's in psychology and honours. She's our hospital to home coordinator. She knows her stuff. I'm very proud to have Cass working for our hospital to home program, and I will take it over and let her share with you about the program and her involvement with that. Over to you, Cass.
Thanks so much, Kathy. Okay, so yeah, thanks everyone for taking time out of your Monday morning to be with us today. So hospital to home. So basically, I'll give you a bit of an overview. We're funded through the Primary Health Network, Went West, and the eligibility criteria to be part of the program is adults aged between 18 to 65 years and have received inpatient psychiatric care. So participants must also reside in Blacktown, Parramatta, the Hills or Cumberland local government areas. And the most important thing is that it's voluntary. So it's not a program that people have to be part of. It's something that they actually want to be part of. Something that's pretty unique about the hospital to home program is everyone on staff has relevant mental health qualifications and personal lived experience. So that combination positions us in a really unique way to be able to support our consumers. Okay, so originally it started in 2017, and the program then was one-to-one support post-discharge for up to 14 weeks. And very similar to the PICS program, there's that kind of support that we offered at that point was recovery, and still offer now as well, recovery-oriented goals. And that can range from linking people in with mental health care plans, bulk billing psychologists, and building bridges between us and the clinical kind of supports, and also even things that you may not necessarily put with mental health recovery. So for example, we assisted a consumer a month ago to adopt a cat, because that was something that was going to be really helpful for them. So we use recovery-oriented goals in a holistic way. So it can be, again, anything from attending TAFE, furthering your education, or finding a job, to getting a pet, or to even attending bingo. That was something else that we assisted somebody with a few months ago, and that was to help them get that social interaction as well. Also linking in with relevant services. Sometimes when people do leave hospital, they might be experiencing some financial hardship. So we can also link them in with money care. We organise food hampers for people when they're leaving hospital, if that's something that they need. We also provide transportation to medical appointments. Obviously, this is pre-COVID, but I'll talk about what we're doing now with the COVID health crisis as well. So something that we do know is people are incredibly vulnerable when they do leave hospital. They're at higher risk of suicide, and people that do actually die by suicide, we found that in the literature, it happens at a high rate before that initial contact with a GP or a psychologist or a psychiatrist post-discharge. So something that we do is ensure that people actually get that connection as soon as they leave hospital. So quite literally, we could actually pick somebody up from hospital and drive them home. So yeah, hospital to home. Also, we can assist people navigating services such as Centrelink, Department of Housing. Those forms can be really, really stressful. So having somebody to actually walk through that process can alleviate a lot of that stress and make it a little bit more manageable. So in 2019, we were actually invited by the PHN to apply for additional funding. And this was in the context of us realising that there was a few gaps in our service. And those gaps were having an organised presence on ward, and also to create an opportunity for social activities for our consumers as well. So through that extension of funding, we were able to provide ward activities, and we were really embraced by Blacktown and Cumberland hospitals to actually deliver those activities on ward. So we've got activities that happen on a weekly basis at Blacktown and Cumberland hospitals. And then also, obviously, we're still doing the one-to-one support post-discharge. But then something else that's really exciting is we've got funding now for social club. So with those three pillars, we've got the ward presence, and then the post-discharge support, and then the ongoing social activities for hospital to home participants. The really exciting thing about the social club is people can attend that even past the 14 weeks. So it just creates that opportunity to stay connected, and also make like-minded friends as well, which we're finding, a lot of our consumers are actually connecting with each other and supporting each other out, even outside of the social club activities. So on the ward, why on the ward? So the idea behind this was to not only have the opportunity to connect with consumers and build that rapport while people are still receiving inpatient care, but also to provide consumers with peer-led psychoeducational activities. So the kind of activities that we do provide are a collaboration as well with peer and non-peer facilitators having input, and basically they go through techniques and skills that our peer workers have found are helpful for their recovery, but also from what our consumers have been finding helpful for their recovery as well. So typically each workshop has a psycho-ed component and then arts and craft kind of activity. The feedback that I've gotten from those workshops by the consumers are that they're absolutely invaluable, and they actually still keep all of the little handouts that they've got and continue working with those even post-discharge. It's also a really good opportunity to talk to consumers while they're on ward about any concerns that they've got about being discharged, and also just teaching them about some services that are available as well, because, you know, we've got all of these beautiful, wonderful services out there, but it's not common knowledge. And I think when you're in the industry, you kind of take it for granted that everyone would know what's available to them, but that's not always the case. So we've also found that around a quarter of the people that attend those workshops then go on to participate in the program post-discharge, which is really great as well. So we've actually got participants requesting referrals because they've had that contact with hospital to home, which is great. Another fantastic thing about the ward activities is that it's improving relationships with the non-peer workforce. And again, all of the nurses, social workers, nurse unit managers on these wards just really embrace hospital to home, so much so that we were actually invited to sort of facilitate a pilot program at one of the wards at Cumberland, Eurola, which is a very, very acute ward. Previously, they were not having any kind of ward activities for these consumers, and the 6-week pilot program really helped, I guess, highlight some of the areas that could be improved, and also it highlighted that the consumers on that ward really, really appreciated having those activities. So yeah, that's something that's still in the mix for the future, but that was a really, really great opportunity for us to be part of that. So something that one of the nurse unit managers has said, and I don't know if I can read it all because I've got a little block out of the words, but I'll read what I can. So H2H has formed a very positive alliance with the unit. H2H creates a supportive pathway into the community for our consumers, providing personalised and sustainable service. The staff of H2H are personable, focused, and regard our consumers as equals, as do we in the unit. And H2H, I don't know what's under that, all approach each person in a humanistic and caring manner that creates therapeutic outcomes for all concerned, whilst helping to maximise potential that each person they have dealing with. Thank you. So yeah, that was a really good experience, and the ward workshops are still continuing as well. So social clubs. So this is the another aspect of the program that was introduced in 2019. And this is really just an opportunity for people to come together, have some fun. There's no real agenda to social club. It's just a matter of getting everyone together and learning from each other as well. So the activities in the community, again, pre-COVID, but I'll get into that a little bit further down. We also meet twice a week. So previously we were meeting at Blacktown Library and then a cafe in Parramatta. And the really exciting thing about this is we've got funding to actually purchase coffees for people and things like that. So we found previously, before we had this extension of funding, that people actually were not attending the sort of social events because there was a lot of, I guess, the financial barriers. A lot of people, $3.50 may as well be $300.50. And then that actually created a barrier for them, even if they wanted to come, they didn't feel like that they could. So just having that dignity of coming to the cafe and enjoying a cup of tea or coffee with other people is really great. Also, the activities that we do are consumer-led. So we started off playing Uno, and then a few people wanted to do mindfulness and colouring in, so we did that. Sometimes we do go for little walks as well. Even going to the local art gallery at Blacktown has always been a big one. And yeah, it's just, again, opportunities for the consumers to come together and we all interact, learn and grow from each other's experiences. Something that's really great with Social Club as well, like I said before, is that the H2H consumers can continue coming to that even after their 14 weeks. And we've found that that's really important because sometimes people will come, and because it's a safe space, they can say how they're doing. So if somebody isn't doing very well, then they've got that great support from other people, and actually being able to talk through, okay, so you're not doing very well at the moment, what can we do to sort of support you with this? And we will actually link people in with other services if that's what they need, if they do come to Social Club and yeah, they need that. So something that H2H consumer said about Social Club was, I was a bit nervous at first. Meeting new people is always hard, but I'm glad I went. Everyone's really nice, and it's just good because there aren't any expectations. It's also good to know that you don't have to worry about money. I look forward to this now. So like Paul was saying, just having a group of like-minded people coming together and having that safe space is really important. Okay, so the evidence. So we know that shared benefits of peer work to consumers do reduce stigma. So, there can be times, especially with a first diagnosis of mental illness, that there's a lot of internalized stigma that can go along with that. So one H2H consumer said, I used to think there was something really wrong with me, like I was broken and worthless. I don't feel like this anymore. Thank you for being so open. So actually having peers talking about their own lived experience and their own ways of handling symptoms and getting back into, having a fulfilling life is just fantastic, because, yeah, the consumers then can see that and then have hope for themselves. Also, we've got lower admission rates. So we've supported over 260 consumers, and within the 28 days post-discharge, we've had 14 consumers go back into hospital. So this is like a 0.05% readmission rate compared to 14.4% Australia-wide. Also empowerment and hope. So again, modelling recovery and, walking alongside somebody that is experiencing their own mental health issues is really powerful. And suicide prevention. So approximately half of hospital to home participants are identified as being high risk of suicide. And this is from the actual referral form. And people going into hospital due to suicide ideation or suicide attempt. And out of the 260 consumers that have participated in the program, we've had 0.004% of consumers dying by suicide. So there is that real connection, and giving those consumers hope and working with them in their own recovery goals is really helpful. So also we do the K10 as well at the beginning of the program and at the 14-week mark, and we found that there's a 30% improvement of people that actually engage with the program. Also, we use the recovery RAS scale, and again, initial score compared to program completion. So on functional scale of doing things that I value, there was 35% improvement. Personal, so looking forward to things, 26% improvement. Clinical, so mastering my illness, so basically learning how to manage symptoms, learning how to where to go for extra help, was a 39% improvement. And social, so connecting and belonging, there was a 19% improvement as well. So in response to COVID, so as I just described, previous to COVID, our service was very face-to-face, providing transport, attending appointments with our consumers. So we've actually adjusted a lot of the support that we do to be telephone and online support. We've also created a wellness workbook. So we kind of got together and thought of all of the things that we do with our consumers to help them in their recovery journey. So for example, even SMART goals, or just talking about, you know, what are your physical needs? What are your emotional needs? What are your psychological needs? And then figuring activities to meet those needs. We've put all of these sort of tools into a workbook, which is then posted out to our consumers. And then that's just a way to sort of like guide conversation on the phone and work through those workbooks with our consumers. Also, we've been assisting consumers navigate medication delivery and online payments. So something that we found was pretty common was people found it very difficult to get to the chemist and also how to pay for things online. So yeah, we've been teaching those skills as well and assisting consumers navigate telehealth. We've also created a closed Facebook group. So this is really, really new. We've not had a Facebook group previously, but with COVID, we've created this group. We've got over 20 participants now, and we're continuing our social clubs through this as well. So still catching up on Tuesdays and Thursdays at a scheduled sort of time slot where everyone comes in. But something else that's really, really cool about the Facebook group is our consumers are actually posting beautiful videos of themselves, you know, playing the violin, singing. We've got people posting artworks, poetry. Our consumers are so talented, and this has really given them a platform to be free with sharing those amazing abilities. So even when things do go back to normal, we're going to keep the Facebook group. It's just such a great platform. We've even found that, you know, even over the weekend and out of hours, it's giving people the opportunity to connect with each other as well. And it's really created a community. So that's something that's, you know, something good that's come out of this. Ward activities, so they've been amended to be self-guided. So in basically just create self-guided activities with instructions that can be printed out by the nurse unit managers and then handed out to the consumers. And then I make myself available for telephone coaching if any of the consumers are interested in that through the week. And then something else that we did was we went through our previous consumers. And as a team, we identified around 42 that may have been at a bit of risk due to living alone and other sort of things, knowing that they may have had limited social connection, and basically gave them a call and asked how they're going, and also did a little bit of a risk assessment. And we, from that, 20 consumers actually re-entered hospital to home for very short-term support. So that meant ensuring that they were able to get their medication, that they understood telehealth, and also offered social club again, and linking them into other supports as well. Of those consumers, we actually had 2 that had attempted suicide in the last few weeks prior to us contacting them. And out of those 20 consumers, none have gone back into hospital, and they're all, yeah, doing really well. So that is hospital to home. I would love any questions that anybody has. I think I was a little bit nervous, like you said, Kathy, I might have talked a little bit fast, but please feel free to ask any questions. Thank you so much, guys.
No, that was great, Cass. So totally understand nervousness. I'm feeling it as well. So yeah. That's great. I just, before we open up to questions from people who are watching and participating, just a question for you both, being, I guess, just an impact. My question is, what impact has it made for you personally being a part of these 2 programs and having lived it yourselves? So don't have to go along, but I'm really quite encouraged, and I really believe the way for currently and future for mental health services is making sure that lived experience is up front and centre and part of our chemistry. So, you know, what has it made for you personally being a part of these programs?
You go, Cassie.
Okay. Yeah, no, I guess I'm just constantly inspired by human resilience, by people being able to, you know, maybe experience some really horrible things, but still coming together and in a really non-judgmental way, just being with each other. And just, there's so many people that from 14 weeks, it's not very long, but our program from when we first meet someone in hospital and they're really not doing well to then where they get in that 14 weeks is inspiring. Also, I am so humbled and grateful for the acceptance in the hospitals as well. So I think that these sorts of programs are changing the perceptions out there as well, because it is actually showing people, yeah, there is hope. You're not, you know, going to stay where you are forever, and that, you know, peers do have a lot to offer, and it's not just, you know, because we've been there, but also because we're able to actually learn other skills as well.
I guess for me, I work with an amazing team. They're a really diverse group of people, and they have, as I'm saying, diverse different backgrounds and different personalities. And it's just inspiring to be working with such a talented group of people. And also the people that we support, I think there's a sense of, I guess I would call it vicarious resilience too, that you get inspired, or you learn something new, you become a better person, and there's a sense of great satisfaction. In this role, you can use your lived experience. There's no other role that I can think of where you can draw on those sorts of experiences in your work. So yeah, that's a real delight to be able to do that as well.
I love that term. I've just written it down, Paul. Vicarious resilience. What a wonderful. Well, it's true, isn't it? And yeah. I think, and that's what I keep learning from you all around this. I think it's beautiful around that. My next question is just around. Obviously, we're hoping we're coming out of some of COVID's darkness. I think that for us at One Door, we've been learning a lot, and I'm sure the whole of community has been learning a lot. But what do you think has been, Cass, you spoke about that needing to stay connected through both the programs that you've got. How have you been able to keep people connected through COVID-19?
I guess.
Yeah.
Sorry, what I was saying briefly during the presentation, that there's been a much greater increase in phone calls, regular phone calls, so the meetings tend not to be as long. For example, when we catch up, it might be for an hour and a half, but phone calls a little bit shorter, but more frequent. And there's also some people who have the technology or the data available to be able to use, I guess, Zoom calls. And I think there's been an effort from One Door to be able to facilitate that as well. So yeah, both of those things have been, I guess, the mainstays of keeping people connected: phone calls and telehealth or Zoom type calls.
Yes, and yeah, I agree. So yeah, we've been doing a lot more phone calls. Again, the Facebook group has been really, really well received. And I guess we've been dropping off food hampers as well to people's homes, and the workbook. So they've still got that sort of something tangible that they can hang on to.
Yeah, I also should mention that the PICS has a closed Facebook group as well, which we've started up during COVID, and that's been quite popular.
Mm.
Yep. So,
Yeah.
yeah.
Yes, I've been learning all these different things in social media. It's amazing what's out there, so it's great. We've got some questions from people, so I'm gonna pull some of them out, as well as I've got a few also of my own. But I think there was a comment around question around, could you expand on how these services could support clients in TAFE studies? So I don't know whether it's Cass or Paul or both of you mentioned about TAFE studies, but I guess in studies generally. So who would like to take that one?
I'm happy to, Cass, unless you would like to first.
No, you go for it.
Okay, with supporting people in, I guess, TAFE and higher education, there's a couple of things. It's all about, I guess, a self-directed recovery. So how does that person want us to support them? But some of the things that we might do is, for example, help with applications, contacting the disability officer or the student equity and diversity unit, so that people have supports while they're in TAFE or in uni. I think they're the main things, and just being with people, and I guess it's sharing the lived experience in, for example, when I went back to study, what are the things that helped me, and that might have been a graded approach to going back to study and education.
Yeah. Something else that we've actually done is provided transport and physical support at open days. So TAFE open days, we'll actually go there with our participants, and also going along to an appointment with the careers advisor at TAFE as well. And with the actual study, we will sit down with the consumer and organise a weekly study plan. So just making those really sort of practical type steps so that they can manage it. Right. And also Hospital to Home has had 2 TAFE student placements as well, that then turned into being peer workers. So.
Oh, fantastic. It's really good.
An easy recruitment system. TAFE is fantastic.
Absolutely, absolutely. Cass, this one's for you. Do you know, and I was trying to reflect on it for myself, do we know if there's any other hospital to home programs across New South Wales of this nature?
Not of this nature, no.
Right. Yeah.
Yeah, unfortunately not.
Yeah.
It's a pretty unique program.
Yeah, yeah. Hopefully we can see more of it come and along these lines. There was a question I had around, I guess, Christine, thank you for you up north around seeing services such as PICS and Hospital Home up north. Is it in our future planning? I would love it to be. I think the key to not only One Door, but all the community managed organisational sector is the fact that you need funding. So I think we'd welcome funding of this nature for these programs. I think each of the primary health networks have been given funding for mental health services and are delivering it and commissioning it in different ways. But happy for you to promote it up there. But yeah, I think we're still very much think that both these programs are very valuable, and you're really seeing the really important nature of those with a lived experience in the way they're delivering services. So I think no matter what service, I think is something we'd promote across the board. And I know that the New South Wales Mental Health Commission and also the National Mental Health Commission, as well as the Productivity Commissioner, are very much pressing these points, which is exciting, I think, from our end. Another question is just in terms of what roles are opening up for carer peer workers. I can just speak for our family and carer mental health program, is that we do have carers who have a lived experience of being a carer. A lot of those are our carer advocates and are working out there. And I know that I think I'm starting to see some of the local health districts take on those roles as well. But I think you'll see across the CMO sector, there's quite a number of organisations such as One Door that are employing people who are carers as a lived experience. So I think that's occurring. Now, there was a question, sorry, I'm just following it up, also around the recovery coach. So the recovery coach role is coming into the NDIS from the 1st of July, and there was a question around, do you have any information on the recovery coach role? The information that I have is that I understand from the 1st of July it's going to be in the price guide for the NDIS. The semantics and the pragmatics around that are still being worked on, I think, from a NDIS planning perspective. I actually have a meeting tomorrow with one of the people from the NDIS with some other peer organisations to discuss that. But briefly, I think if we look at it, it is about supporting participants to aim with the aim to foster hope and build capacity and resilience through strong and respectful relationships. We're hoping, and it has been told, that it will have a component where there will be people with a lived experience coaches as well as recovery coaches. But I must say there hasn't been as much information as I think we would have hoped. But hopefully we'll have some more of that information coming out soon. Well, I think I'm not the only one that's sharing that view, but I think a lot of us are hoping for that as well. So I'm just following up from some other questions. So the question is, do peer workers in these two programs use your own vehicles to transport peers? I.e., do you need a car to be a part of the workforce? That's some more logistical stuff than I potentially may know. Cass and Paul, do you want to comment on that?
Yeah, so we do. And having a driver's license and access to your own vehicle is part of a requirement for the hospital to home peer workers. There are other peer work roles out there though that don't require that.
Also, we have a peer worker on our team who doesn't have a car or doesn't drive and uses public transport to go between meetings with people. So I don't think it's an absolute essential, but it certainly does help. It makes things a little bit easier.
A question I have for you both is, what can we do as a sector, and I think as people implementing programs and developing programs and those kind of, what can we do to strengthen our peer workforce? And I think also the part I want to get to is, how do we make that really loud to others to say, hey, this is what we need to do? So I'm just wondering from you guys, you live in it, you're breathing it, how can we strengthen, what can we do better? Big question.
Yeah.
Do you want to take us on?
Paul.
I think what we do in PICS is that we're working with the nurses, and there's a great sense of being on the same team. It's not a one is better than the other. And I think that sort of equality there, I mean, just through that service and the way we work together is an example of it. I suppose promoting that, and which is what we're doing now, promoting that as a model, perhaps, for others to try, or for us to be able to extend throughout the state.
Yeah, I agree. And I think also, continual professional development, seeing it as a legitimate career path rather than, just a job that you have because you've got lived experience and you're doing really well and you want to share that, but having it paired with qualifications and continual development. I think it needs its own space. I see peer work as going in the direction of being a profession equivalent to nurses, social workers, psychologists, and it's not replacing, and it's not us versus them. It's coming together and just recognizing that this is a very important piece of the puzzle.
Absolutely.
Sorry, I was going to say, Kathy, also say, thanks to One Door, is that that we're being supported to attend a certificate for in mental health. And so it is sort of, not legitimizing it, but I guess professionalizing the workforce of peer workers.
Absolutely, yeah, I agree. And I think I'm looking forward to seeing, I know this week the Productivity Commissioner is due to hand down their final report to government. And I guess when we do get to see it, I'm really hoping that we see a prominent role for those with a lived experience. So, and we saw that last week when the national, Christine Morgan announced the National Pandemic Mental Health Plan, and the role of lived experience enmeshed through that. So very much for us at One Door, it's about making sure that's in the feet, not just in the words, but in the things that we're doing. So it's been wonderful. I just want to say thank you both for sharing. Is there a final word you want to have around the role of lived experience, being a peer worker, delivering these services?
Thank you to One Door for recognising the importance of this, and that I think, and I believe, and I see it happening, that it's going to keep going the way it should, which is up. And yeah, it's great. So I did not have the words that in my brain, they did not come out then.
That's fine.
And tag Paul, you're it.
I also think, say with all manner of people out there, whether you're a health professional, whether you're not a health professional, you do other types of work, talk about your experience, be human about it, and break down the stigma that way. It's a great thing to talk about it and share our stories.
Yeah.
And that's part of being a peer worker, but I think it can be a part of anyone who's experienced it. It's good to talk about it.
Yeah, I agree. I think what you do about saying being human, I think what we're trying to do at One Door is very much about that, and us all being on that same level playing. And I love the part you said, Paul, about being human. That's wonderful. And I think the more we can do that with each other, and in no matter what we do, I think more we're touching people's lives. So thank you. That's a lovely, lovely way to end. I just want to say thank you to everybody else who's joined today, and this has been our first one. It's been a wonderful hour we've been able to spend together. If you haven't joined, there are other sessions you can do this week. So we've got one coming up after at 1 o'clock today, and I'll just get Gus to put that on. Basically we've got Dr. Frances Dark, who's talking from about, which is being hosted by the Mental Illness Fellowship of Australia. And she's talking on mental health rehab and psychosocial interventions. So that's coming up at 1. If you haven't signed in, it's open now. You can go to the link and follow that up. Then we've also got a number of great speakers this week. Cass and Paul have set a high benchmark. We've got the Minister for Mental Health, Bronnie Taylor, who's coming on and having some time with me tomorrow afternoon. So please feel free to join us for that. Tomorrow night also we've got Dr. Anne Honey and Darren Wagner, who are going to be talking about making lived experience research accessible in the lives of people living with a mental illness. So again, we're really wanting to highlight the importance of lived experience. On Wednesday, we have a carer with a lived experience who's speaking from her journey. Her name's Bernie Mullen. She's a board member of One Door, but she also is willing to come and speak to us about what it's like to be a carer, as well as our own Richard Schweizer, who's a person with a lived experience of schizophrenia, who's also going to talk about his own journey. So some great people talking on Wednesday. Thursday, we have Professor Pat McGorry from the Centre for Youth Mental Health. He's speaking on early intervention for young people with psychotic disorders. And on Thursday afternoon, we've got Stephen King and Catherine Lowry from the New South Wales Mental Health Commission. Stephen, who's the Productivity Commissioner, as I mentioned before, they're going to be submitting their report at the end of this week. So they're coming to talk about the Productivity Commission's inquiry. So we'll hopefully get some hints about that report. I don't know. And Friday, we're kicking it off with some music. And why do you not end a Friday and end of the week with without focusing on music? And it's wonderful that we've got Esther Paverwood from Mostly Mad Music coming in the afternoon to do that. And we've got some musos coming on board over the weekend as well. And I think also on Friday morning, if you get to have a look at it, also we've got someone from Caring Fairly, which is about focusing on what have been the carers' needs during this time. And I'm really excited to hear that. So it's been wonderful that we've been able to focus on being this whole week on what it means about raising awareness around mental health and schizophrenia. So I want to thank you for joining. Just a little plug, Gus, if you can do the next screen. We've got there's a great little charity called Caring Kids, which provides toy boxes for kids who has a family member who's got an illness, including a mental illness. And if you've got a whole stack of toys around and you want to donate some of your toys and they go to kids who need, or you've got some lying around, some new ones. I know my kids seem to store up a whole lot of fluffy toys. I consider going to the Caring Kids guys. So there's a plug for them. They're just a little volunteer, a great charity to really get behind. So I'm just plugging that for this. And I'd just like to say thank you. Watch all the social media. We're going to keep plugging this week around Schizophrenia Awareness Week and all the things that we've got. I look forward to hopefully seeing some of you the next bit. So that's it from us. Thanks a lot. Bye.